Okay, so we talk about blisters. So any blisters, if you just clean it, sometimes there will be an area where the blister still has skin covering some of it. You should try to clean all the blood out from under that, and then just take the Q-tip and go underneath that flap so that you're covering the surface of the skin that's bleeding. That's really what you want to cover. Okay? Let's talk about feeding tubes. We're up to that. A feeding tube is what they call a peg. It's usually a hole in the stomach where there is a tube that comes out. Now, I remove every feeding tube. Now, I will tell you that it takes a little bit of guts the first time because it does have tension against it. But know that every patient in the hospital who has feeding tubes tend to pull them out. And they pull them out, they don't hurt themselves, they pull them out because they're just uncomfortable for them and they pull them out. If you give a little tug, just a quick tug, comes right out. Doesn't do anything to the skin. It'll be just a regular hole. You didn't do anything to anyone. Just pull it out. Because if you don't pull it out, it's going to stay there. And it's going to leak anyway, unless you want to make a big clamp and have them just a feeding tube sitting there. But you pull it out. And I would say that 75% of the time, nothing happens. It's just a hole. You do the whole tower and it stays. That's it. And there's no reason to deal with it. Yes?
What if it's leaking?
I'm going to get to that. That's the other 25%. There are times where it does leak. And sometimes what comes out can have a very bad smelling odor. But the point is, leave it. When you turn the body, you do this, remember, you're doing all this in the survey. You're doing this before you even start washing. As you turn the body, it can flow very heavily. Sometimes, looks like a fountain. It's like just, it can come out. Why should the person be buried with all that junk? Okay? It's really what it is. It's junk. So let it come out. Let it flow. When you turn the other way, it might flow again. If you are careful when you place the body in the mikveh, and again we'll talk about that when we talk about the mikveh, the question then becomes that what do you do? If now you've finished the tahara, you're about to dress, and it's still coming, you know that when you turn to pull down the shrouds, it's going to keep leaking. So you have this same stuff again. I would go into the opening with a piece out this length. Okay? It's not as thick as when you pack rectally. Make a little head to it. And you again insert it. It could be with the edge of a scissors, with the edge of a clamp, with a toothpick, whatever it is. Just go into it till it's below the surface. You may want to make a little head to it again so that it's tighter. Okay? And here, you have to judge. If you think it's not going to be a problem, just this, leave it. If you think it's going to come through anyway, and sometimes it actually almost fills as you're putting it in. This is the one place, or one of the two places, but it's really the one place. There are a few options actually now. There's more options. This is the one place where I would consider using glue. Because nothing else works, except for something else which I'll show you in a minute. I am not a big fan of using glue in the tahara process. However, when you pack this, if you pour a little bit of crazy glue, something like it, right on the cotton, don't get it on the body, just on the cotton. The cotton is below the surface. It will harden and it'll be fine. Even if it's wet. And if you want to, if you push it just a little below the surface, you can take another little drop of, I'm talking about really a drop of cotton. Just put it right on top of it and put on a little more. And that'll stop it. I have never had a problem where it did not stop with that very easily. Okay? There's one other option, and that is if you want to use Tegaderm. Tegaderm is something we are now using occasionally. It's very expensive, which is why many Chevras do not use it. It comes in a lot of different sizes, pretty much the same shape, but a lot of different sizes. So let's use the smallest one that I have with me, which is this size. Tegaderm is it's called Tegaderm.
What size is this one?
This is very small, whatever it is. This is much too big for that. There's a much smaller size than this, okay? But what you want to do with this is, it's basically, you see sometimes a body comes with like a plastic on their hand covering a blister. That's what this is. It's very simple. You have to learn how to use it. Because if you don't, if you're going to try to take all this off and just use the plastic, it's going to, not against itself, it's going to stick against, you'll never be able to do it. So you have to learn how to do it. You can take it. Now, basically, it's made for people who don't know how to use it. So, let me show you how it works. I'm saying it's made for people who don't know how to use it. They made it very simple, so it's user-friendly. What you want to do is, when you take off the outer layer, there's one part on the inside that has a little open piece, and then there's one side that covers the whole thing. The sticky part is under here. So this still has a border which keeps it in place. So as you take this off, you put it over that area, dry the area first so that it will stick, cover it, get it flat because it's easy, it still has the border and there's tension, you pull it all the way off, and then once it's on here, you just remove the border. And it's sticking fine. Okay, do you understand what I just did? You remove the border, remove the solid side, okay? While the border is still there and the sticky side will be exposed. So then you put it on while this border is still there, put it on the area that you want to cover, and then once it's on, and it's perfect, you remove the border and it's done.
What do you do when you don't have Chevra?
Okay, so you don't have to use the crazy glue. That's what I just told you. This is instead of crazy glue. If you don't want to use crazy glue, you can cover this, put a piece of cotton in, cover it with this, and it'll be fine. Okay? Now, all right, so that is how I would deal with that. A Foley catheter, which is a urinary catheter, you can do it one of two ways. The simple way, one thing you should be very careful about, do not pull on it, because just the slightest pull on it could very often cause bleeding. It's not going to come out without releasing the pressure that's there. So what you want to do is just cut the tube, let the urine flow. Do it obviously after the person has been taken out of the pouch or the wrapping they come in. When they're on the table, undressed, covered, just cut it and let it flow. It'll flow for a few minutes, it'll stop. You can wait a minute or two and then it just pulls out very gently. Okay, and that's it. The other way is to put in a syringe. If you're fancy and you have syringes, you can put in a syringe, pull out the urine that's there, and it collapses the same balloon, and you pull it out again. Okay?
If there is a bleeding because we pull it and we didn't know how to do it, how do we stop the bleeding?
You stop the bleeding by packing it exactly the same way. The same is true with rectal bleeding. If you have bleeding from the rectum or bleeding there, you just pack it with some cotton and a little bit of blood cells and it'll stop. Okay? That's it. Now, but you have to be, as I said, very, very, very careful, okay, when you're removing it. Now, one more thing, sometimes there are tubes in the mouth or even in the nose, intubation tubes, and they too have a little balloon inside. If you try pulling them and they don't come out, what you need to do is you'll always find a little thin plastic tube that is coming from that's alongside it, and it has a balloon at the end. Cut the tube, that collapses the internal, allows air in, that collapses the internal balloon, and then you just pull it right out. So you'll always look, wherever you have something going in the mouth or the nose, sometimes it goes into the trach, okay? And just cut the balloon, cut the little tube that comes out, and the balloon will collapse, the outer balloon will collapse, the inner balloon will collapse, and then it pulls out very easily. Okay? If there's bleeding on it, if there's blood on what comes out, save it, and pack the mouth or the nose or the trach, just like we discussed before.